Good afternoon, listeners. Today's discussion centers on a headline that's been echoing through the halls of policy and economics: capping the price of healthcare is a mistake. This view comes from Dr. Lorenz Helmchen and Dr. Tony Lasasso, two health policy researchers who recently published a guest essay in the New York Times. Their central claim is simple but powerful: the idea that we can solve the soaring costs of medical care by simply setting limits on what hospitals, drug manufacturers, and insurers can charge is fundamentally flawed. They begin by acknowledging a fact that's hard to argue against: healthcare prices are extremely high, opaque, and they often diverge from any reflection of quality or convenience. Still, the authors argue, the fact that prices are distorted is not proof that a government-sized cap can fix it. It's tempting to see a price tag as a single number we can hand over to regulators, but that intuition overlooks a lot of nuance. Drawing on the classic economist Friedrich Hayek, Helmchen and Lasasso remind us that the knowledge needed to coordinate a complex market is dispersed, local, and often tacit. In more concrete terms, the price of a piece of equipment or a surgical procedure carries clues about what people value, where capacity is scarce, and what alternatives exist. Think of a hospital that charges a premium. That could be because it has monopoly power, or it could be covering the costs of keeping emergency rooms open, training new doctors, or simply delivering better care. A central authority can't magically split all those variables into a single, static number without messing up the signal. When regulators make a rule like no one can charge more than X dollars for a hospital service, they effectively substitute administrative confidence for decentralized knowledge. The government is then claiming to know the maximum price that makes sense, but in practical terms it rarely does unless the industry's own pricing perfectly reflects all costs and patient values. This flaw becomes even sharper when you consider that consumers are willing to pay more for convenience and superior performance. Medicare is a case in point. Historically, Medicare pays the same rate for a service regardless of whether it's delivered by an exceptional provider or a mediocre one. While Medicare attempts to adjust payments for quality and safety, its formulas can't capture all the reasons a patient might choose a particular doctor or hospital. As a result, high-quality physicians sometimes shift away from traditional Medicare patients or add membership fees to cover services that Medicare does not pay for. When the government imposes capped prices, it rarely rewards excellence and can even disincentivize the supply of top-tier care. There's an additional jailbreak in favor of price caps, an erosion of incentives to invest in big bets whose payoff is uncertain. Think about the rollout of new imaging technology. The upfront cost and uncertainty of improved outcomes can push a provider to hesitate. If their revenue is capped, that hesitation can become the default. Over time, the innovation pipeline slows down, and the industry's ability to improve care remains stagnant. To sum up, Helmchen and Lasasso's essay tells us that while high healthcare costs are a problem, the way to address them isn't a blanket price cap. The market already provides signals, though garbled, that tie cost to value, quality, capacity, and innovation. Attempts to flatten those signals risk creating a distorted market that discourages excellence, curtails innovation, and ultimately undermines the very goal of quality healthcare. Thank you for listening today. Stay tuned for tomorrow's episode where we explore alternative policy designs that respect the knowledge embedded in current price signals while still aiming to reduce wasteful spending. Until next time, keep questioning and keep learning.